Good day, dear friends. This is Natalia on the channel Dr. Savkina, where I share my personal experience and answer your questions. Quite often, many of us encounter pain in the sacroiliac joints, and most often the right sacroiliac joint hurts. Sometimes the pain is unbearable. It doesn't let you rest either day or night. This lowers the mood and subtly brings on depression. Pain in the lumbar spine can occur for various reasons, due to damage to the joint itself, as well as problems with muscles, ligaments, and cartilage. They can be accompanied by numbness and limited mobility in the joint itself. Familiar symptoms, aren't they? They can occur at any age, but most often in the elderly, as bones become brittle over the years. The hip joint has a complex anatomical structure. In its area, there is a whole network of nerve channels, which explains the spread of pain along the leg, with a return to the back or groin area. The first thing patients do when they experience pain in the hip joint area is seek help from a therapist. In most cases, doctors attribute the symptoms of this ailment to arthritis of the hip joint. Moreover, some specialists, without delving into the details of the disease itself, make a premature verdict. Only joint replacement surgery can solve your problem. In reality, there is no arthritis at all. It's not even close. The pain in the thigh area is related to a completely different reason. For example, due to the inflammation of the bursa or problems with the lumbar spine. To navigate and understand what the thigh pain is related to, specifically in your case, I will try to explain the main causes of its occurrence in an accessible form. So, approximately every third person with a diagnosed Coxarthrosis, as practice shows, actually has inflammation of the hip tendon, Trochanteritis. Representatives of the stronger sex most often encounter this problem, especially during the climacteric period, when there is a weakening of the muscular ligamentous skeleton and the hormonal restructuring of the body as a whole. In young age, this ailment can be encountered as a result of trauma or overloading of the joint. I started skiing in winter, became engrossed in this unusual activity, and pulled my thigh. Trochanteritis develops quite quickly. Within 3 days, after a long walk on uneven terrain, climbing or descending a mountain, falling on the side with a thigh hit can lead to inflammation of the femoral dry joint. What can be felt when trochanteritis develops? First of all, pain appears on the outer surface of the thigh, which intensifies during walking or lying on the painful side. The pain from the very beginning can be quite intense, in some cases unique in its character. It resembles a toothache. Unlike Coxarthrosis, the leg easily deviates to the side while freely rotating in all directions. How to understand, is there Coxarthrosis or not? For this, you need to try to sit on the stool upside down. In that case, if this action is difficult or not possible at all, as it turns out, we are dealing with Coxarthrosis, not a trivial trochanteritis. Some doctors mistake Coxarthrosis for the syndrome of the pear-shaped muscle and the Piriformis syndrome, which occurs when the lumbar spine is damaged. Unlike arthritis, pain in these ailments occurs sharply within an hour or two after any unsuccessful movement. A sharp turn when the body is tilted or when lifting weights. In addition, in this case, chronic pain in the lower back often accompanies the onset of pain. In this case, the pain usually only spreads to one leg. With Piriformis syndrome, the greatest intensity of pain is noted in the buttock area. In case of sciatica, the pain seizes the area from the buttock down the back or side of the leg, the so-called sciatic pain. all the way to the foot. At the same time, the lower back itself does not hurt in most cases. However, with Piriformis syndrome and sciatica, severe pain in the lower back or thigh often occurs, most often on the back of the thigh. This is especially noticeable when trying to lift a straight leg or lean forward while standing with straight legs. With Coxarthrosis, movements of this kind usually do not cause sharp pain. As practice shows, it is extremely rare for the sacroiliac joints to be affected even in cases of arthritis. But they get involved in the process much later than other joints. Therefore, by the time pain appears in the sacroiliac joint, the diagnosis is usually already confirmed. Moreover, there are clear signs that allow us to distinguish osteoarthritis from arthritis. First of all, arthritis affects people of a young age. The peak of the pain syndrome comes in the second half of the night. The pain does not decrease with a change in body position, and by evening it practically subsides. There is one important signal that indicates the inflammatory nature of the pain. This is morning stiffness, which is primarily characteristic of such diseases as rheumatoid arthritis, polymyalgia rheumatica, and ankylosing spondylitis.
So let's continue.
By sitting down on a chair without much effort when there is pain in the hip area, we thereby exclude Coxarthrosis, a common diagnosis given by participating therapists. Let's move on. When there is a syndrome of the piriformis muscle, the maximum pain comes to the buttock area. For the piriformis syndrome, the most characteristic is the colic pain. When the hip tendons are inflamed, initially there is intense pain in the area of the outer surface of the thigh. In the position of lying on the painful side or during prolonged walking with arthritis of the sacroiliac joint, the peak of the pain syndrome comes in the second half of the night. The pain does not decrease when changing the body's position. It is accompanied by stiffness of the joint, and by evening it practically passes. Thus, pain in the area of the sacroiliac joint, as many doctors believe, is not always a sign of arthritis of the sacroiliac joint. By its nature, each of us can suspect the presence of one or another disease and seek help from a specialist. Rheumatologists, orthopedists, and neurologists can help with this problem. You were with Dr. Savkina. Subscribe to my channel so you don't miss out on many new, interesting, and useful videos. And be healthy.